Good afternoon, and I want to thank everybody for being here today. As you know, today is the first day of the special session on violent crime. Violent crime has been a problem in our state long before COVID-19, and we have seen it escalate even more in recent weeks, especially in our big cities. The number of homicides we're seeing is devastating and unacceptable. Innocent lives are being lost, futures cut short, and families are hurting. We cannot continue to let violent crime destroy our cities, communities, and families. Doing nothing is not an option. We need to do everything we can as soon as we can to get violent criminals off our streets. Last week, we traveled across the state to meet with local leaders, legislators, and law enforcement officers on violent crime and special session. We were in Columbia, Cape Girardeau, St. Louis the week before in Kansas City, talking about the importance of this special session. 2 of the days that I was out during when I was speaking to the roundtable discussions, there was homicides committed across the state just during those times. This has got to stop. You have the support of the communities, we have the support of the legislatures, we have the support of everyday people, but we have to address violent crime in this state, and especially targeted towards homicide. Since last year, my administration has been working to address violent crime. When St. Louis asked for help last fall, we answered the call by committing state personnel to task forces in their city. We have worked with the African American community, the clergies, civic and community leaders, law enforcement, and mayors across the state to develop solutions. By working together, we proposed legislation last year to help fight violent crime and make our communities safer. And we were very disappointed it didn't get to the finish line. None of us, no matter where we're from, want to see innocent people and children being shot in the streets. We have a serious problem with violent crime that continues to escalate, and we cannot wait until next year to find solutions, which is why I called this special session. As I said before, this special session will be narrowly focused on violent crime and the steps we can now take to address it. Specifically, this session will focus on 6 provisions relating to violent crime. They are endangering the welfare of a child, witness protection fund, witness statement admissibility, juvenile certification, unlawful transfer of weapons, and the police and public safety employee residency requirements for St. Louis. We truly believe that these are tools that could be used in many of the situations we're seeing today, and we are committed to doing everything we can to get these done. On the COVID-19 front, we continue to monitor the data here in Missouri each day. As you know, we have been experiencing an increase both in testing and positive cases this month, which has caused a backlog of data processing and entry at the state level. So while we are experiencing increases in cases in certain areas, these increases are partially a result of the backlog. It is important to understand that the daily numbers represent a wide variation in when samples were collected, when tests were done, and when the results were actually reported and entered. This is why we continue to focus on the 7-day positivity rate, which is at 8.8 for the week of July the 10th through July the 16th. Testing matters. We can use it to help fight the spread of COVID-19, and also that means contact tracing is very important. Tracing the contacts of someone who tests positive for COVID-19 is an important weapon in the fight against COVID-19. If you find out you were exposed to someone who tests positive, you should self-isolate and get tested. Responsible behaviors help limit the spread to others. The state government has an important role in supporting local public health agencies with contact tracing. Here are a few highlights of what we are doing. The Department of Health and Senior Services has 37 contact tracers who have supported the local agencies since the start of this outbreak. DHSS currently is training additional 150 contact tracers to support local agencies' response to COVID-19 surges in their communities. DHSS has also provided specialized support, such as translators and other public health experts, to support local agencies. We are also identifying state employees from various departments to be trained as contact tracers. At the state level, we are developing a free standard training program for any contact tracers in the state. The state has also made significant investments in the IT and data management systems to support statewide contact tracing. Our new Missouri Advanced Contact Tracing System will support contact tracing efforts statewide as well as other important public health activities. So far, the state has committed more than $7.5 million in an effort to modernize public health technology. And let me be clear, state government can help, but contact tracing depends upon the work of our local public health agencies. They know their communities, they have the trust of their neighbors. That is why it is important for our local health departments to receive the Federal CARES Act funding to build their capacities for testing and contact tracing. Local counties and municipalities have been given more than $500 million to support COVID-19 response activity. But so far, not enough of the money has gotten to the people who are doing frontline public health response. We have surveyed local health departments across the state. Out of 81 responses, only 17, about 20%, indicated they have received CARES Act funding support from the counties. We have to do better. Again, I want to call upon leaders across the state to prioritize getting their CARES Act funding out to the front lines. We have came a long way since March, and we need to continue to move forward. We have provided guidance on how these funds can be used to keep us safe. We are not defenseless, and we must all do our part to keep our families, friends, and fellow Missourians safe. Today, this will be our only briefing this week. On Wednesday, I will be speaking to the Springfield Chamber of Commerce. We also will be traveling to several school districts across the state this week to meet with superintendents, administrators, and teachers to talk about their plans for this fall. With that, I hope everyone will have a good week, and please continue to beware of COVID-19. The same prevention measures I have said every day for months still apply. Social distance, wear a mask, wash your hands. Thank you, and God bless. I think Dr. Williams is here today to make a few comments, and then we'll turn it over to questions. We'll just start with Dr. Williams. Kelly. Dr. Williams?
Thank you, Governor. One of my jobs is to serve as a vehicle to pass along the comments from the clinicians that I work with all across the state. So Saturday morning, I'm on a call with the Missouri State Medical Association. The governor and I are on a call at 10 with the ID doctors. And then I do an echo every Monday I lead with doctors out of the University of Missouri. And I want to share with you their observations that highlight what the governor is saying. Mark Hahn, who's with the Kansas City Medical School in Kansas City, said, as we open up, we are doing a good job of delivering that message. But clearly the demographic of people in their 20s and 30s are not hearing the governor's other message, which is that COVID-19 is still with us. So we very much, in talking with Boone County Health Department, who presented today at the noon, about 60% in a college town of their case contacts know who infected them. I mean, it's very obvious how it's being transmitted. And so we're seeing that phenomenon especially. So I mentioned to you a week ago, I think it was on Wednesday, that we're seeing this specifically in 5 areas, and we're seeing it specifically among a demographic of 20 to 30-year-olds that explain our positivity rate of 8.8% now of the 7-day rolling average. We try to listen to your questions. Sebastian last week, I said, why can't you put that on your webpage? And we said, well, we should, because I look at it every day. And so we put that on there. It's 8.8% now. Our overall average is at 6.6. Our R-naught, again, the ability of someone to infect more people, is now almost 1.3 all across the state. It was 1 in St. Louis. It was 0.89 about 5 weeks ago. But now in all the different sections we check, it's 1.3, meaning one person, by our modeling, would infect 1.3 other people. That's more than the flu. So we think we have a diagnosis. We think we have an increase in cases. We think that increase in cases is primarily driven by social contact among 20 and 30-year-olds. That persists. We look at our hospitalizations. They're going up, but not like what we saw back in April. And thankfully, partly because of the demographic that's being affected, we're not seeing the corresponding morbidity and mortality that we saw back in April. And all of that's on our website. So again, I always appreciate your feedback, but today we'll go with the Blues. They're going up to Edmonton. But we just really need everyone, but especially our young people, because we do care about them, as they congregate, which is what they do. They need to use hand washing, because that does decrease respiratory illness. They need to social distance. It just doesn't come natural to them. And they need to wear face masks if they can't do the other. So today we're going to go with the Blues. And again, we just think it is imperative. The data we're getting from St. Louis City, St. Louis County, Kansas City, University of Missouri, Boone, is that these trends are persisting. So with that, we've talked about testing. We are now doing 5 times more testing than we were doing in April. We're doing 90,000 tests a week, which is just remarkable. But as the governor said, that also is going to explain our positivities. We do have a backlog because of all those tests, and sometimes we get data dumps. But I need you to remember this. I'm going to say it twice. It's that important. It never delays our reporting of positive cases. We do that by phone. We may not enter it into the computer, but within 1 to 2 hours of getting a positive case from any lab, we contact the local health department. So I'm going to say that again. Whatever we say about a backlog, and you may hear, well, it took us 4 days to see it on the computer, but our standard is we make sure those local health departments know within 1 to 2 hours. If you know differently, I hope you will let me know, because that's certainly the expectation that we have, and I'm told the expectation that we're meeting, to call them. Now, we may not enter it into a computer for 3 to 4 days. That backlog will be gone by Friday. We've hired 100 people. 33 start today. We had 40 that we're using from our own shop, and we had 30 more on Wednesday. So we will be caught up on Friday, but we'll continue to go forward because we continue to get more cases. On contact tracing, I need you to hear from me that we think that is vital. That the example I use is like going to the doctor and being told you had strep throat and then not getting an antibiotic. We need that contact tracing to take place in a timely fashion once the health department is notified. And so as the governor said, we are pushing that as hard as we can. But, and again I'll say but, the governor's office got out that $500 million in 10 days in May. And as he said, we polled 81 health departments and only 17 have gotten their money yet. So I just left the meeting. We put it on our webpage to make sure there's no misunderstanding about what you can spend it on. We've told you how to spend it. and we're going to double down on those efforts. And anything you can do to help us with that, because I can think of no better way for a county commissioner to spend that money for testing, PPE, and contact tracing. So I'll stop there. I'm sorry to talk so long, but I think those things are really important. Kelly?
All right, we'll open it for some questions. Jack?
Okay, so hi.
Hey, Jack.
I noticed that there's no community testing events scheduled right now, and is that gonna? Are you stopping those?
I wouldn't say we're stopping them as the need arises. You know, we've been in more than 50 counties, Jack. And so the real purpose of that was to give us, as we were kind of entering into the recovery phase, where we stood and coming out of the acute phase. We still reserve the right to do those and may have situations where there may be a cluster in a community, and we want to see what the background is. To your point, though, and my point, that is also a great way for counties to use their CARES Act money, is to do that similar surveys of their communities. So thank you for the question.
So you don't think? I mean, do you think that they're necessary, these community testing events?
I think they're helpful, Jack. I really do. I think that both for individuals, you know, I think overall our positivity rate was about 1% for a good while. And I just, you know, I went to 5 of them, and I think people were incredibly appreciative. And I also think it gives people confidence as people wonder just what is the background, that it is probably not as high as they think it is.
So I'm just wondering if it's helpful. Why don't you have them? Why aren't you having them right now if they're helpful?
Because I think we've done 50 counties, and I think that right now we're kind of pacing to do others if we need to. Sorry.
Dr. Williams, what is the backlog at right now? Are we still under?
Yeah.
Are we under 7,000?
Yeah, Emily, I think today it's 6,000, and
Okay.
we're going to knock it down by about 1,500 on Tuesday, Wednesday, Thursday, Friday, and on Friday, by our calculating the number of FTEs and how many cases they can look at, and 100 people doing it, we should be at 0 by Friday.
Okay, bear with me through this next question here. Last week, the governor said that, and you agreed, that there is a contributing factor from these backlog of cases that we're seeing positivity numbers go up. But if that number, if you guys are getting that out within the hour of a positivity test, why are numbers still going up from this backlog when you guys get that result right away?
Because we determine our backlog from the computer. And so if we take 2 or 3 days to put it on the computer, then that backlog adds up. But we call the health department because we don't want that to happen. We don't want to say, well, we've got a backlog. It's going to take 3 days to put it in the computer, and then the health department will see it. We want to call them immediately. So the statistical backlog is because it may take us 2 or 3 days to get it in, but that is not the patient notification, health department notification. And
we're seeing a lot of states and cities. I know St. Louis is looking at restricting some bar operations. When you look at the numbers in Camden County at the Lake of the Ozarks,
Yeah.
when you look at June 14th, there were about 39 cases. On Friday, they announced there was 225. That's a huge jump in a month when they were keeping steady at 36 for
Right.
weeks. Do you attribute that to tourism, and what do you kind of think needs to happen there?
I wouldn't say tourism. I think my message for the last 2 weeks has been pretty consistent, is that we think, and again, I'm not trying to stigmatize them, but we just think from talking to local health departments, and when they do their case contacts, the message I got just 2 hours ago from Boone County was, when we do our case contacts, there are 8 or 9 people that come from these 1 cases, and when we go back, were you wearing a mask? No. Were you social distancing? No. I just got to, were you symptomatic? Yes. I didn't want to miss. I went out and had a cough and a fever. On all those measures, I think the temptation to go out in the summer and congregate is great, and because we care about 20 and 30-year-olds, we do not want them to get COVID. We do not want them to infect other people, especially somebody who might be a vulnerable population, a fragile population. We really, really need them to follow those basic public health measures. And I think that's just another data point that shows that's probably not happening.
And a quick follow-up here.
Hi, Dr. Williams.
Hey, Connor.
That positivity rate, that 8.8.
Yeah.
I know last week you said that it's been, throughout this pandemic, it's been about 3 to 4%. And I think I remember asking you, and you said, when would that be concerning? And it was about at 10.
Right.
Is it, I mean, it's approaching that number, so are you
Yes.
getting concerned about that right now?
Yeah, Connor, I think, the two numbers we've kept in mind are 10, which is we clearly want to be under, and then 5, which we ideally like to be under, and we were for a long time. I've said this so many times, but we treat the patient, not the chart. So when we look at that 10%, it would be very much on our mind what that population is. So if that was a 10% of 20-year-olds, then we would have a much different look at that than if it was 70-year-olds. And then we also have to take that number in hand with our number of hospitalizations, because one of the reasons we think we're not seeing the hospitalizations and mortality as that number has risen from 3.9 to 8.8 is because it's in a less vulnerable population. So to answer your question, it's not like when we get to 10.1, that's an automatic trigger because of the other factors I mentioned. We look at it holistically. But you are correct, that is a number that nationally we look at as kind of a thing to step back and go, okay, we need a fuller explanation of just what this means.
Dr. Williams, some top U.S. health officials have said that they're looking at Missouri as potentially being one of the coronavirus hotspots, looking into maybe the next few weeks, the next month. What do you have to say about that? And do you think that reopening the state the way that it was done is attributing to that?
Well, about 5 days ago, we were a yellow state. I mean, we were still one of the states that wasn't orange or red. And a lot of states around us were orange and even red. So if that's changed in the last 5 days, I'm not aware. Now, I follow it nationally every morning, and clearly we're identified as one of those states that have more cases. I mean, you can look at that and see that. There's some explanation for that, but we clearly think that's a real phenomenon, that we have more cases now than we did a month ago. The feds were just here in Kansas City. They did HHS brought in a team and looked at it, and we've been in conversations with them. And so while we certainly would share with the feds or anybody else that our number is increasing, we certainly don't think we're in the situation that Arizona and California and Texas and Florida, just to mention, are. We think we have a very different phenomenon going on here than some of those states in which they're seeing a very marked increase and associated morbidity.
Dr. Williams, we've got two more questions.
Okay.
We got to get Governor Parson one at a time. Right here in the curve.
Oh, I had a question for Governor Parson.
Good.
Okay. Cool. So, Kurt,
Was it a mistake to not just give CARES Act money straight to the health departments? Now obviously there's a blockage for some reason.
I don't think so, Kurt. Thank you for the question. The county commissioners are the holistic governor of their county, and there are other needs other than public health. We certainly recognize that around COVID-19 funding. So I think that was well thought out and would do it again that way because, there are other groups, social services, behavioral health, public health. There are lots of different groups that need that money to carry out their service. And so, no, but at the same time, I think we need to do those things that we're capable of doing to inspire them or get them to do that along. So, no, I think that was the right thing to do. Thank y'all.
thank you. Governor Parson.
Okay. Hi, Governor Parson. I was outside the state capitol, and there were protesters outside there earlier, too. They said that your agenda more so punished crime than prevented. What's your response to that?
What was the question again?
Protesters felt that your agenda more so punished crime than prevented. What's your response to that?
I'm not sure I understand your question yet, but
Protesters that said that, what was the phrase? Punished?
Yeah, punished crime than more so prevented with more so like juveniles being trialed for adults. So they're concerned about that.
Let me just say this. Everything we're talking about is violent crime. So if it's a juvenile getting certified to as an adult, that means they've been involved in a violent crime, not an ordinary crime. All of this is generated towards violent crime. I don't think there's anybody in the state that's not in agreement we need to stop the killings going on in this state. And that's exactly what this is, another tool. But I will stress to you again, and you asked me what I would say to them, this has to do with violent crime, homicides. This is not everyday juveniles we're talking about.
Regarding special session, some of the legislators introduced bills that are outside of the purview of your call for a special session. Have you seen any of those? Are you thinking about expanding the scope?
No, I haven't seen anything the legislators have introduced. I'm telling you, we're narrowly focused on the points that we have right in front of us right now.
Yes, Governor, good afternoon. Your roundtables last week, I know you were in Hannibal and you were in Southeast Missouri, St. Louis, Kansas City, et cetera. How did those go? What was the biggest takeaway, feedback from that, from either local leaders or law enforcement?
Yeah, one of the reasons I went to Hannibal, Cape Girardeau, is I really wanted to make drive the point home that this violent crime is just not a Kansas City, St. Louis issue. And I think sometimes because of such a high rate they have, we just think, okay, maybe that's their problems. And it's not. It affects everybody in the state of Missouri, of how people look at our state, what our future looks like in this state when you see those violent crimes, those homicides. So I think going to those small areas and really getting to visit with some of the small town mayors, the commissioners, local law enforcement, they're concerned about the same things that we're talking about today in special session, and they're looking for any tools they can have to be able to fight violent crime. And I think it was Hannibal, it wasn't too long ago that they had a homicide there. They had some shootings there today. So it can happen anywhere right now. We just got to address the issue.
Governor, this is the follow-up that I wanted to ask Dr. Williams, but I'll ask you. Both New York and Pennsylvania have added Missouri to the COVID restriction list. So if somebody travels from our state to those states, they have to quarantine for 14 days. What's your thought on that? And just back to the whole tourism aspect, when you have the Lake of the Ozarks and Branson, big tourist attractions for people coming into the state and maybe not following some of those CDC guidelines to slow the spread of the coronavirus?
Well, first of all, I'm not going to put much stock in what New York says. They're a disaster to start off with, the way they've handled their situation. So I think probably people smart enough in this state probably don't want to go to New York unless you just had to go there for some reason or other. But look, I think the travel situation, people will pretty well figure that out. You know, when you look around us, when you look at these coronavirus cases going up, you could look at Texas, you could look at Arkansas, you could look at Illinois. You know, all of those are around us. We're escalating for weeks now before us, and, you know, all of that's a concern. But, you know, I wouldn't put too much stock in what New York has to say about Missouri, to be right honest about it.
Governor Parson, you said that you're traveling to some school districts throughout the week. Earlier today, there were some protesters of teachers that were outside the Capitol that want you to make a decision. They want the decision to come from you to go virtually online. They think the districts don't have enough. What is the conversation that you're having this week with those school districts that you're visiting?
Well, I think we're going to be seeing how are they addressing how they're going to open up this fall. How do we put those guidelines into place? What's the best practices? Look, I think the majority of schools in this state, as of today, but again, I want to stress to you, things with the COVID-19 virus change daily. But right now, I think a majority of the schools want to be open. And I think as long as we can make the students, the teachers, the people inside there as safe as we possibly can, and at the end of the day, it's about getting kids educated. And I mean, that's the real goal of what we're trying to do here. But I think there's a lot of good administrators out there. I think there's a lot of teachers, my daughter being one of them. I think she believes, and a lot of teachers believe that, and that it's hard to replace that in-classroom portion we have. And I'll say this on the personal side, what I see. I worry about kids that are in poverty if they don't go back to school. I worry about kids that's got disabilities and if they don't get back into a school setting of some sort. I worry about those things. A lot of those kids like that don't have as many choices as some others privileged to have. But again, we're meeting with them this week. We're trying to figure out what are they doing to move forward in the schools. How do we make it safe? And again, how do we move forward with that? Every day it's about moving forward.
Hi, Governor. You mentioned identifying state employees to serve as contact tracers. Can you kind of talk about your vision for the scope of that? Like, would it be one person per department or per office, and would that replace their full-time job duties otherwise?
Yeah, I think whatever that need would be, I think as long as we can get within state employees, if we can train somebody in each division or each department, whatever that might look like, to be able to do that within ourselves, it just makes us better. Also, if they're trained, they have the ability to go out and train someone else. And maybe someone that falls a little bit under their purview of what it is they do. So I think as many people as you can get trained to be able to use those resources, whether it's across the state employee side of it, or their state employees go out to different areas to be able to teach. It just gives us more opportunities to do contact tracing.
Connor, final question.
Hi, Governor. Just going back to the special session, just kind of thinking about the financials of it, just funding a special session right now and the budget crisis we're having in this state. Are you worried at all about funding this right now and potential other special sessions if you're thinking about that?
You know, every day you're worried about funding when you're in a crisis like this, but look, funding's not important as human lives. And when you got people out here dying in the streets of Missouri, and you got children dying out here, you got to weigh out what's money versus life. And right now, special session's about life. It's about trying to protect people out there. That's why that's important now. Look, I wish we wasn't spending money, but the reality of it is, this is more important than what the dollar amount is.
Thank you.
All right, thanks everybody.